We'll start with the film, and then this session will be chaired by Moon Abdelaziz, who is the Director of Public Health and Wellbeing at Salford Council. Thank you.
This is a music project aimed purely at men, the idea being that men can come together and write and record original music together in each session. It's a fairly short project, it's been 8 weeks, just a pilot project, and we're hoping to learn from it whether this format works and whether the men are finding there's a benefit to songwriting on their mental health. We've been really aware that men's mental health is an issue right now, that a lot of men don't necessarily find the spaces or the people to ask for support or to go when they're struggling. So we wanted to provide that space. We're lucky enough to have Phil and Rob facilitate the sessions, both really great musicians, which is brilliant for the group because they're being led by people who genuinely do this for their living.
We've been looking at developing skills around music making, be that music technology, instrumental playing, lyric writing, but all the while really exploring the wellness benefits that you get from active participation with the art form. And also the communal elements that we get, because music is primarily a social art form, so it's looking at the bonding and how we interact with each other.
When I first came in on the first week, I didn't speak to anyone, I don't think. I don't think I opened my mouth. On this 8th week, I've written a song and I've stood up in front of people that don't know, and I've actually sang this song. I couldn't even imagine me ever doing anything like that, but it's inspired me. These guys running it have given me the confidence to do this. It's a major thing for me. I'm very happy. I mean, Stockport, it's a musical town, you know, so it should have a group like this, and I think that'd help people like me.
Hey, Mr. Music Man, pin back your ears and listen to our plan.
I've been quite overwhelmed really with the response from the participants. What those participants have done in this short time is find a space that feels safe, feels supportive, but really inspiring.
This work is necessary. There are not a lot of opportunities for men to be given a space to come and be creative. And when the figures state so clearly that they don't access any sort of other support or wellness support or even just basic healthcare support, the fact that we can offer a place where people can come and actually express themselves, take part in something, bond with other men, not be isolated, feel open to discuss issues, but then also just come along for a brew. I think it's one of the most important projects I've been a part of for quite a while.
Thank you very much. So, I mean, thinking back, we've been really inspired by the conversations that have happened today, and even that wider perspective that ENO Breathe gave us, I think, is amazing. So we have been inspired, but I think leaving the conference, we want to leave with some ideas about the next steps. What is it that we will do collectively and individually to make sure that we do embed creative health into our everyday health and care activities? And it's a difficult question because some of it is going to be very personal to the context in which you operate as an audience, as individuals. But also, it's going to be difficult for us to reconnect with each other unless we make those connections now. So without further ado, we've got several perspectives here from art, from the creative sector, but also from Luke in terms of the economic perspective as well, and CVS in particular, to help us think about what are the next steps that we should take out of today. So I'll start with Luke. I'm just going to go around the order rather than the order in which the agenda goes. So look, from your role as a senior lecturer in health economics at the University of Manchester, how come you got so interested in this area of work? And what can you tell us about, the next steps in economics? I always think money, and we know money is important. So you might tell me it's nothing to do with money at all. So over to you, Luke.
Brilliant, thank you. So yeah, I'm a health economist, not to be confused with a healthy communist, which some people do make. And then there's where the tensions with money comes in. So I got into this through sort of personal experience, and so people realise my accent is from the Northeast, which also has a very strong creative heritage, but it's so underfunded that we need to make the economic case and help people to realise their potential. So I had a number of questions that I would pre-specify, and I'll just go through those in turns. And as an academic without slides, this is incredibly nervous, so bear with me. So the first one is, can and should we make an economic case for creative health? So I think the first really subjective question is, should we make the economic case? And I think we probably shouldn't, because we've seen there's just so much benefit in terms of happiness, feeling of belonging. People feel like they have a purpose, they have something to energize them, to motivate them, and to make them feel like they belong and feel a really strong part of the community. We needn't think of everything in terms of money if we want to be a really functioning, happy society, but unfortunately, because of years of subsequent governments decimating public finances, there just isn't enough money to go around. So we need to make really compelling cases for why we should invest in creative health, why should we make that argument. Commissioners are under real pressure. They need to allocate their budgets in ways that we maybe haven't thought about before. And there's a welcome shift towards prevention rather than cure, but we haven't got the evidence base in terms of return on investment yet. And I think that's where we can really sort of pioneer the way in creative health. So I think, can we make the case? Well, yes. So the NHS do loads on funding drugs and treatments for curing people, but why can't we do that to prevent people's health from getting bad in the first place? Or why can't we use the same approaches for non-medical interventions and prove their value for money? So I think this has been mentioned a few times, and Kevin made a really great point earlier. A lot of this boils down to data and good data. We need to know how people feel about this, what happens to them as a result of participating in some of these interventions, but more importantly, what would have happened if they didn't do it. So what is the sort of counterfactual, for want of a less academic term, what would have happened if the people who've benefited from creative health hadn't engaged in creative health? So we need to think about that. Now, there's lots of different ways of getting data, so probably the most gold standard is to collect data, ask people questions about their health, about their use of healthcare services, about how well they feel, but obviously that costs a lot of money and it gets quite intrusive. You don't want to keep asking people lots of questions all of the time. So another alternative is to make use of administrative health and care records. So if people go to general practice, why do they go to general practice? What happens when they go to A&E? Because all of these things have costs to the system. If we can prevent this happening, then there are substantial cost savings to be made. Then what we really want is to link those two things together. So we want people's experiences of how they feel about their health is uncoupled with how many prescriptions they have, how many times they go to general practices, etc. The second question is, given we have this data, is it cost effective and is that important? And I think if we do imagine we have this great data, then we can use these economic methods to really look at the benefit and the cost effectiveness of these interventions. The problem, although it really shouldn't be a problem, it should be a benefit, is that these interventions are sort of multi-agency and multi-sectoral. So the health system works incredibly well if the NHS pays for the drug and they benefit by improved health. Here, the NHS aren't really paying for this. It's local authorities, communities, some of the great organisations we've seen today are paying for this. But then they're not necessarily seeing the benefit in terms of reduced hospitalisations. That's being accrued in a different system. So how do we line everything up so that everything is in one pot and the health system doesn't worry about its budget, the local systems don't worry about their budget. Everyone should be contributing from the same pot. But we do have ways to do that, and I think there is a move towards that, as we've seen the move towards prevention. So I think there are tools that we can use to do that, and I won't bore you with all the specifics of the economic methodologies, but these things are possible, and I think we really should do them more and more in this space. But we need to think about who the audience is. So what's important in the NHS might not be what's important to local or combined authorities. So can we do this holistically so everyone can see what the benefits to their system and invest their money in the best way and stop duplication of effort and get everybody singing together? And then the final thing is, how do we know if this works? And again, that just depends on who the audience is. We know that these things work, but how do we demonstrate that they work in a way that are meaningful to people who hold the budget? So I say we have got a set of toolkits and things we can do, and I think we do need to do more of this. And as I said, we have seen a rhetoric of a shift towards prevention. It's been mentioned a few times, the leftward shift of the dial. But I think we really do need to operationalise this and use some of the toolkits that we have to really make the case and to really continue to see this sector thrive. And Giles's point earlier on, we just live in a sort of a hand-to-mouth situation. We need to break that and look at the fidelity and the sustainability of these interventions, because if you're constantly worrying about how you're going to fund tomorrow, you're never going to maximise what you're doing today. So we need a long-term vision to really realise some of the benefits that we can and will get if we do this right.
Thank you very much. Thank you, Luke. So it's about the money and data, who benefits and who pays, but how can we collectively make the case? Thanks, Luke. So I'll pass on to Emma. So Emma, you are representing 10GM, the VCSE sector. And from your perspective then, why is this important and what would be the next steps? So Emma.
Thanks, Muna. So I think I'd start by saying that the VCSE sector often acts as this kind of bridge between people and systems, so people's everyday lives and the policies that kind of shape and determine a lot of our health and well-being and our lives. And when we say VCSE sector, we're not just a kind of homogenous blob. We're talking about 17,000 different, really diverse community groups and organisations. And I always say that at the beginning because I think it's really important to, think of the VCSE sector as an ecosystem that's complex with, roots and connections between and around ourselves. And we've heard from many of those today who are kind of doing such incredible creative health work already based in neighbourhoods and communities. So what do we actually need to do? So my first feeling is that as a system, I think we're still on that journey to see health not just as an absence or a reduction of illness, but as something that encompasses our identities, our culture, our expression and the way that we connect with the world around us. So I think first and foremost, we should be concerning ourselves with the creation of healthy places, the physical, environmental, economic conditions that actually shape and determine much of our lives, sometimes before we're even born, because we know that actually where you're born has a huge impact on your life chances. And actually, all of this is the bread and butter of the voluntary and community sector, which is fundamentally about people coming together to do things they're passionate about, that, do great things in their local community. So I think with Live Well, we're really poised here. We've got an opportunity here. There's the mayoral commitment, there's the political commitment that I know a colleague from ENO talked about earlier. So let's really kind of latch onto it and make the most of it. And for those of you who are creative practitioners, we need to make sure you're around the table as we design what Live Well actually looks like in our neighbourhoods. We're starting to talk about Live Well centres and spaces. So how actually can those house and be kind of built and supported by artists, creators, makers in our communities? How can we create those as assets as well? Then secondly, I was a little bit scared that Luke and I were going to disagree on this, but we don't. I think there's something for me about, as we embed creative health in our health and care system in a more kind of formal way, some of the stuff that you were talking about, Giles, about this being a part of our care pathways, not an add-on, it's just a fundamental part of what we commission. I think there's something for me about being really careful to frame it not purely through a set of medical metrics. So, yes, absolutely, we do know that, X activity will result in a reduction of Y condition, or it will save the NHS this much money. But actually, I think it's so important that we commit to keeping a human lens on all of this, because people don't view themselves as illnesses. And I think we've really got to hold true to that if we're going to not just do this and embed creative health in our health and care system, but do it in the right way. So I think there's something about, yes, those measures are fantastic. And yes, I think pragmatically we absolutely should be making the economic case. But how do we actually use insight and intelligence to measure what actually matters? I think the video was a perfect example of that. How do we understand, hope, joy, resilience, connection, and value those just as much as we value the economic argument? So I really like to keep that in our minds as we go through. And then finally, really building on the previous panel, but, partnership. The VCSE sector brings professional skills, deep trust with communities, knowledge and innovation to the table, but we need those systems to value and resource the work we do, and that includes the long-term investment that we need to be able to harness creativity and creative health. And I think we need to do that in a way that reflects the diversity of the creative health ecosystem, so from our large cultural institutions right through to the individual artists and small community groups that actually make up the majority of the creative health ecosystem. So I think there's something about being brave and bold here. We know resources are scarce, but actually there is a choice about, collaboration, not competition. And, for those commissioners, for those funders in the room, I'd implore you to think about, actually, can you be really brave and think about pooling some of those scarce resources, recognising that, yes, that is going to involve, a little bit of a step back from that kind of control, but actually recognising that the more we support collaboration, the better and more effective our results are going to be. And that also, I get told off if I didn't say this, but that also involves supporting and valuing and resourcing the infrastructure that sits around all of that. So the networks that exist, the local voluntary sector infrastructure organisations that bring people and organisations together to make a difference in our communities. And that's the last thing I'll say, really. We need to listen, we need to trust, and we need to not be afraid to think and do more radically. And I've certainly got that energy in the room today and really excited about what comes next.
Thank you, Emma. Thank you, Emma. So to be brave, but also to be present in those rooms and to work collaboratively, make sure that the sector and the ecosystem have a voice and are around, and making sure that commissioners as well appreciate that point. Thanks, Emma. So we've got Jackie next, Jackie Wood. So you're the CEO of ARC. Tell us a little bit more, and what are the next steps?
Thank you. I feel like I'm going to be echoing some things, so I'll try and make it more individual, organisational based. The question around being about embedding creative health, I want to kind of put it in the context of ARC as one organisation and how we're embedded within Stockport. So we began as part of the local Mind Association back in 1995, which is also when Arts on Prescription began. We didn't actually begin it, it began in Stockport. And so it's been quite a long time of arts and health being very, very present in the borough. It's not always been easy to make that case, but ARC became an independent charity 20 years ago, and we've always had a really close relationship with our local CCG, which is obviously part of GM now, but the Stockport locality, to the point where I would say our commissioner, she so totally understands the value of our work that I would say I work with her and she works with me in terms of the strategy. So I can report to her every year in ways that I know are incredibly useful for her to then report to the rest of her colleagues. I'm not trying to use arty-farty language or, it was interesting, 'cause there's been some interesting points made today about language from the beginning. Rachel, I think, was talking about not wanting to, I'm going to talk in NHS speak, so you're all going to switch off, those of you from the cultural sector. Actually, I don't think we should. I think that's the point. We should all be debunking the language from both sides so that we are talking the shared language. There's been a lot of shared language today, which has been brilliant about how we're all working collaboratively towards the same goals. So I would say with our health commissioner, we are speaking the same language. She will come to me and say, we've got this issue. Is there anything that that you could think about as a response to that? That's brilliant. I will also report to her in terms that are useful. We have a great relationship with the local authority, with public health, with the VCSE sector, with local businesses. We are involved with training nurses at Chester University. We're involved in training healthcare staff on the mental health wards at Tameside Hospital. So all of those things are, I suppose, how we are embedded as an organisation in our locality. The challenge is how that rolls out. And this feels like this. I've been around a long time. I've seen many versions of these kind of wonderful ideals in arts and health, creative health, call it what you will. I'm desperate for it to actually move on and be a systemic change, is that the word I'm after? Rather than, so I think it just has to be broader. And this feels like this is exactly the right time. This project and the investment in this project makes me feel that this is the moment for that to happen and be much broader. Even for us who've been around forever and have this wonderful and challenging growth in Stockport, because every year we have to fight for every penny. We've been lucky to get a grant from the NHS for the last 15 years. Every 2 or 3 years, obviously, we have to rebid. I still don't know what our deficit is going to be next year. Yeah. So it's not like it's easy and, ARC just get given the money. But we've got to get rid of some of that short-term thing and use this project as a way of launching that systemic change. The film, I think, illustrated the thing that drives us as an organisation, which is kindness and compassion and hope and creativity. I said it is one thing, and I've listed several things. Not good. But it's the human experience, and I think that's why our commissioner gets us. If she ever leaves, I'm stuffed. As a human being, she understands the value of what we do, and I think many of my colleagues in the healthcare sector understand the human condition of what we're doing. So that must be the starting point for that shared language. That's why when we're training nursing students, we start doing a presentation in the first session, they're like, oh my God, what are we doing having a creative health placement? I've come to learn, I'm on my BA to do nursing, what on earth? By the end of it, actually the feedback is about what they have got from it, how they see that it can work with their work, but how it's really supported them in the last 6 weeks. So that human experience is really what we're about. That's why that was an excerpt of a larger film, and I chose it because me and Julie have often watched it, and you can't help but feel something when Matt talks. It is there. Nick and myself were a double act. Nick has very kindly agreed to come along with me because it's about the human experience, and Nick is my human today.
Thank you. I didn't know I'd gone after the video of Matt. I don't think I can do as good a job as illustrating what ARC do. But what I want to try and do is talk to you about my personal experience within this and how ARC has helped me. So I'll spare you the tragic X Factor style backstory, but 6 years ago, almost to the day, actually, I had what most people still call like a nervous breakdown, a big one, and I got a really severe stammer and verbal tics that worsened under any kind of stress, and it never really got any better. So for me, where ARC came in was like that kind of second stage of somebody who experiences like a life-changing illness or injury. I get through day to day, that's kind of okay. I had limitations, didn't like talking to strangers or addressing a whole theatre full of people. But I lacked purpose. I'm sure you've all had conversations today, and the first thing is, oh, what do you do? Well, it's quite hard to say, I don't really work, I don't know if I'm going to work again, whatever. I needed to do something, and I was uncharacteristically brave, and I self-referred to ARC in the end. I could have joined a gym or a football club, and there are now lots of really good men's mental health clubs. But ARC gave me that progression in a way that I don't think many of those can. The first impact was really big, because I've always been somebody who felt creative but didn't have an outlet, and ARC let me do that. And you know, we made a mess sometimes, and we made some artwork others, and seeing that on the wall was hugely rewarding, and inviting my friends and all those kind of things. You might think, well, yeah, it's not that different to a gym membership. Maybe not too many people are going to put my 10K time on the wall, but like it's broadly similar. The key bit for me was the next stage, what happened next with ARC. I moved to a group we call Enterprise, and what that is basically a self-contained unit within the wider group where we design and make products that we then sell online and in our shop and at makers markets. And what this does is that the revenue then funds the materials for future products, allows us to buy in artists to teach us new things, and fund, partially obviously, the projects to help those people like I was when I first walked through the door. And that's the transformative bit. For me, like, now I get the satisfaction of that creative stuff still, but it's hugely amplified by strangers coming up and saying, oh, I love this, I've got to buy this, how much is this? That's immensely satisfying. And at a market, seeing the stuff that me and my scrappy bunch of friends with a wide range of mental health problems made, and seeing them next to established professional artists, and seeing that our stuff stacks up, there's a huge sense of well-being and self-esteem boost, and you don't get an awful lot of that if you've been off sick for a long time. But the other side of it is this kind of entrepreneurial incubator where what we've got now is a low-risk outlet where we can learn every aspect of running a creative business. You know, we look at everything. We look at packaging and pricing and ROI and stock control and looking at new products. But we do it at our pace with the guardrails that Jackie and her team have put around it. And you can get as involved or not as you want. So with this, I'm sort of edging back to the question, is with this kind of paced personal development, with the amazing support of Jackie and her team, and that positive reinforcement, altogether, it has totally changed my life. I used to be one of those terrible people that you read about in the newspaper, you know, the people who've withdrawn from the workforce. But I don't want to be that guy. I'd do anything to get back to work again. But I don't know, maybe 2 years after I walked into ARC, literally not being able to speak, like the first couple of weeks, I wasn't like Matt, I didn't want to. Every time I tried, I couldn't. Maybe 2 years after that, and a year after being told I'd never work again, I initially got some freelance writing work. And more recently, I got a job doing viewings at an estate agent. I'm not going to change the world with it, but that's a customer-facing role where I need to think on my feet, and there's an element of time pressure and all those kind of things, and unpredictability. And that is a big step. I couldn't have contemplated this without ARC. I'm not the only one, like tons of people who've got these similar stories. And it's interesting you've talked about data and gathering data, because I'm an outsider here. I don't know how any of this works, but I don't know how you measure success. What it has done is it's reduced my reliance on public health. Like, I take less medicine now. I see my psychiatrist, my doctor less often. Like, I'm contributing to the economy and all those things. My kids have less mental health issues. Like, I don't know how that all works, how you measure that, but art and its pathway through has been truly transformative. So that's kind of my story. Is this? Is this where we ask Warren for money?
Yes.
Right.
Yes,
Okay.
yes. We ask them all.
Okay.
Thanks, Nick. Thanks, Jackie. So I suppose, you've actually changed the question for us, Nick, because our next steps mean so much. Just the first step for someone else, that's our legacy. So I'm really pleased to have hosted, ARC and heard your story, Nick. Thank you both. Just Jackie there, just to summarize a little bit, you talked about having a relationship of we work with each other, with the commissioner, and that you report to each other, and it seems it's an equal relationship. So I suppose that's contributed to you being embedded in Stockport. I think for us then, taking this away, how can we get embedded into our local areas? Because it will only start locally. You can't embed yourself nationally if you don't have a presence locally. So those are two really important insights that you've given us as well. So Jane, you're a creative health consultant. From your perspective, what are the next steps? Tell us a bit more.
Thank you. And it's a real honour to be here today and involved in this programme in a very small way, because I'm possibly the only person, I think, who's not living in Greater Manchester at the moment, coming from Bristol. But anyway, next steps for embedding creative health in the ecosystem of health and social care. I feel a bit like I'm preaching to the converted, because I wrote some notes on this yesterday, and really everything I'm saying has not just been shared in this room, but I think much of it is actually already being embodied in this room, which is so exciting and fantastic to see. And I'm right behind you, Jackie. I've been a part of this sector for a very long time now, and I've been around the block a few times. It's not often I get excited by what I see happening, and I feel really excited by what I can see happening here in this room. So my 3 recommendations for next steps are relationship building. So relationship building based on mutual trust, respect, and understanding. And that's happening here. That's happening here in bucketfuls in this room and in all of the stories that we're hearing about. The second thing is collaboration and co-production around common goals. So there's so much collaboration going on. There's a lot of discussion around what are the common goals, what are the health priorities, or what are the real needs of the communities, the individuals, the people that we're working with and supporting. So how do we foster those conversations to enable those collaborations and make sure that they are really centred around the needs of people and common goals? And the third step, I think, is one that has been touched on and maybe one that we need to think about a little bit more, and that's inclusive and accessible commissioning models and realistic resourcing to ensure that we can deliver a safe and sustainable creative health programmes into the future. So many of these are being embedded already, but what I thought I might share with you is a kind of really brief exploration of how the Creative Health Quality Framework can further support these activities of relationship building, partnership building, collaboration, co-production, and also thinking about inclusive commissioning and how we realistically resource this work moving forward. So if you haven't come across it yet, and do go and look online for it, the Creative Health Quality Framework was developed by the Culture, Health and Wellbeing Alliance in collaboration with myself through a really robust and inclusive process of engagement with health partners, researchers, funders, and more than 200 creative health practitioners from across the UK. It was launched late last year, 2023, and we've just received the evaluation of the first year of it being piloted and put into practice. So I feel great because now I can talk to you about its benefits, calling on the evidence from the evaluation. The Creative Health Quality Framework is centred around 8 quality principles, and those are person-centred, equitable, safe, collaborative, creative, realistic, sustainable, and reflective. And they were really carefully thought about what the 8 principles should be, bearing in mind that we wanted to come up with language that was really accessible, but also principles that we felt really worked across the arts, culture, the voluntary sector, health, social care. What the framework, I think, well, it aims to do many things, but one thing that's particularly relevant here today, I think, is it really tries to create a shared language, again, something that we've touched upon. How can we talk to each other across the divide of health, arts, and culture in a way where we can understand each other? How can we find a shared language so that we're not twisting and changing ourselves in order to be understood, but we're actually talking in a way that we can develop consensus? So it provides a shared language and concepts that particularly help art, cultural, voluntary sector organisations articulate what they do, how they do it, why they do it in certain ways. So what does good look like? What does quality look like in practice? So that they can demonstrate credibility, especially working with partners from outside the arts and cultural sector, who maybe don't really understand what creative health practice is. So this means that arts and cultural organisations are better resourced, they have the language, they have the concepts, to really underscore the professionalism and the quality of their practice. What does good look like? How do we articulate and how do we share this? And this, I think, might help provide reassurance to health partners who are building new relationships for the first time with arts, culture, or voluntary sector partners. So it's a great tool for starting conversations. It's a great tool for coming together across the arts and health so that you can start conversations around, well, where is the shared territory here? Where are the shared values? What are our common goals? How can we work together? But it's also a great tool for increasing understanding across the divide. So once you understand what your shared values and common goals are, you can begin to really use the quality framework to unpack practices. This is how we work, and this is why we work in this way. This is how we build trust, connection, belonging, resilience, hope. This is how we do it. I want to say it's not magic. I mean, it is magic. But actually, it's a practice. And if you break that practice down, you can really understand the ingredients, the really essential ingredients that go into building that magic. So I think the framework can really help start those conversations, but also deepen those conversations and build connection across arts and health. But I mentioned a third step. I mean, those first 2 steps I think are really important. They are the first 2 steps. But my third recommendation for a third step is around inclusive and accessible commissioning models and realistic resourcing to ensure safe and sustainable creative health programs, not problems. I was just noticing how many of the quality principles I'm using in my language, realistic, safe, sustainable. I'm hopeful. I'm an optimist. I'm definitely a glass half full person. And I am really hopeful, especially given everything I'm hearing in the room today, that the more we build trust and understanding, the more this will naturally lead to collaborations that will then move on to the development of commissioning models that really support this work and enable some of the smaller creative organisations to access and benefit from the funding to sustain their work. But without realistic resourcing, many creative health organisations and freelance creative health practitioners will struggle to survive. And I think that's a really stark reality that we need to think about now if we want there to still be a creative health sector by the time this amazing programme comes to an end. So if we want creative health to thrive, we need the legacy of the Greater Manchester Creative Health Programme to include long-term sustainable structural solutions. And already we've been hearing about that here and in the last plenary session. So, yeah. Delighted to be here and really excited by the work that's happening and really look forward to seeing how the conversations develop. And I should maybe just mention that my role in the programme moving forward is to work with the 5 cohorts of Creative Health Champions to deliver some training, particularly around the Creative Health Quality Framework. How can you make it work for you? How can you put it into practice?
Thank you, Jane. So I've got an eye on the clock. We don't have time for questions from the audience, but what we invite you to do is to reflect on your personal next steps. But Jane, you've given us there a framework for quality and for sustainability. And I think the sustainability of creative health should speak for itself in the transformation of the life experience of people who join in these creative health programs. So thank you as a panel. You've been really helpful, and thank you for the audience as well. Back to you, Julie. Thank you.